Hi everyone, I hope you guys are keeping well. In this video, I'm going to talk about spinal stenosis and I'm going to share with you 6 exercises that you must do in a daily basis. I'm going to share with you the signs and symptoms and the cause of this injury, and at the same time, I'm going to share with you a couple of tips that you should follow in a daily basis while you're doing these exercises. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update and don't forget to press that like button. Let's get started.
Spinal stenosis is the narrowing of the space within your spine which can put pressure on the nerve that travel through the spine. Spinal stenosis happens most often in the lower back and the neck. Some people with spinal stenosis may not have any symptoms, and others may experience pain, tingling, numbness, and muscle weakness. The most common cause of spinal stenosis is aging and wear and tear changes in the spine. However, the other risk factors for spinal stenosis are spinal osteoarthritis, degenerative disc diseases, or ligament thickening or bulking. Spinal osteoarthritis happens when the smooth cartilage covering the facet joint start to break down and bones begin to rub against each other and may lead to formation of abnormal bone growth called osteophytes or bone spurs. The resulting inflammation and osteophytes formation can contribute to narrowing of the foramina. On the other hand, degenerative disc diseases happen when the disc lose hydration and start to flatten, and the intervertebral foramina also start to narrow. This result disc bulges to push into the spinal canal and the facet joint and accelerate their degeneration. The symptoms of lumbar spinal stenosis is divided to decreased endurance during physical exercise and activity, weakness or loss of balance, numbness and pricky feeling in your legs, calves or buttocks. You may experience aching or dull back pain radiating to your legs. However, these symptoms may improve when you sit down or lean forward or lie on your back or sit with your feet raised. You may experience neurogenic claudication, and if you're experiencing any of these symptoms, you may visit your physical therapist for correct diagnosis. The treatment option for spinal stenosis is divided to physical therapy and strengthening exercises, rest and restriction of physical activity that bothers you, injection to help reduce the pain and swelling in acute cases, medication and analgesic to reduce pain and swelling. If you're suffering from spinal stenosis, in this routine, I'm going to share with you a conservative treatment, which is included exercises and rehabilitation routine that can help you to reduce your pain and improve your mobility. We are going to start this routine with posterior tilt, which is a movement that your pelvis can create, and in many cases, we have a limited range of movements in this position. To apply this movement, you're going to use your hands underneath of your lower back and apply pressure with your lower back down to your hands. You can hold in this position for 3 to 5 seconds and try to relax your lower back. You can try in both sides. Putting your hands underneath of your lower back can give you an indication of the pressure that you need to apply. Try this exercise for 3 sets of 8 and hold for 3 to 5 seconds. The following movement that I'm going to share with you in this routine is going to be cat-camel modified version that I'm going to basically arch my back and come back to neutral. The reason behind that is if you're suffering from spinal stenosis, we'll try to avoid hyperextension movement in our lumbar spine. You're going to copy my movement and try this exercise for 3 sets of 8 to 10 repetitions. Make sure that you're breathing while you're doing this exercise. The following movement that I'm going to share with you in this routine is child pose, which is effective stretch. And if you're suffering from spinal stenosis, you can apply this stretch in a daily basis 2 to 3 times and hold this stretch for 15 to 20 seconds. You're going to breathe in and out while you're staying in that position, and this specific stretch can help you to relieve pain from lumbar spine and the hip area. You can move towards the right and left and try to hold in that position for 10 to 15 seconds. Breathing is essential in this particular stretch. You can try this stretch as many times as possible through the day for pain relief. The following movements that I'm going to share with you in this routine is bear dog, which we simplify bear dog with single leg kickback initially, and we're going to share with you here how to progress single leg kickback to full bear dog. As you can see, I try to minimize any movement in my lumbar spine and my upper back, and I'm focusing on engaging my core and minimizing any movement in my upper body. Breathing is essential in this exercise, and you're going to try this exercise for both sides. When you got more comfortable with your lower body, you can add on your upper body, which means single arm movement, and similar effect in your upper body and lower body. You're trying to minimize movement, and gradually you can progress this to alternate legs and arms. As you can see, it's a slow tempo, and you're going to try this movement 3 sets of 5 in each side. The next movement that we're going to try in this routine is going to be hip bridges, that you're going to try for 3 sets of 8 to 12 repetitions in a slow tempo. To engage in your glutes muscle, you're going to push your knees outward when you get at the top and hold in that position for 1 second. Make sure that you're breathing in and out while you're doing this exercise. You're going to finish this exercise routine with dead bug, which is an advanced exercise for your core strengthening. And if you're suffering from a spinal stenosis, this can be beneficial for your pain relief and also improving your overall confidence. Make sure that you're not lifting your lumbar spine off the ground when you're moving your upper body on lower body, which means you're trying to push your lower back down to the ground while you're doing this exercise. Make sure to breathe in and out while you're doing this exercise, and try this exercise for 3 sets of 8 in each side.
I hope you guys find this video helpful. If you have any question regarding spinal stenosis, disc bulges, chronic lower back pain, or if you want to basically review your MRI report, you can always leave me comments. If you need further assistance, you can always book an online consultation with me that we can go through your basic case specifically and create a customized rehab plan for your recovery. I do have an 8 weeks rehab plan for chronic lower back pain, and if you're suffering from that kind of condition, this can be a suitable plan for you to follow and get your basically recovery as quick as possible. I'll leave a link below and you can read more about it. And if you have further questions, always leave me comments. Before you leave this video, make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Until next week, all the best.